Now let's discuss who is at risk, increased risk for cervical cancer. The main risk factor is the human papillomavirus, or HPV, as Dr. Garcia-Serra just mentioned. So let's go first into the basics 101. What is HPV?
HPV is a sexually transmitted disease. There are about 100 different subtypes of HPV viruses.
So it's not just one strain.
They do not all cause cancer.
Okay.
And so the statistics say that at least 50% of all sexually active adults will be exposed to HPV at some point in their lives. And what's important to note is 9 out of 10 people who are exposed to HPV will clear the virus on their own. Not everybody who gets exposed to HPV develops cancer.
So just to reaffirm, HPV can go away on its own?
Exactly.
Okay.
The own immune system will clear the HPV.
Okay. Now, Dr. Ratcliffe, are you seeing, we mentioned thankfully with the use of the pap smear, we've decreased the risk of cervical cancer, but is this something you're seeing HPV a lot of as well that causes?
Yeah, so as Dr. Garcia-Serra mentioned, HPV is very prevalent, and at some point in most people's reproductive lives, they're likely to be exposed to HPV. In fact, a pretty elegant study done over a decade ago looked at the point prevalence and incidence of HPV, for example, within a college-age population, and found that at that age, in that age group, when people are typically finding new partners and beginning to engage in sexual activity, that the prevalence is actually pretty high. So we do see a lot of HPV, particularly in younger individuals, and it is something that we now see more because we know about it and we are actually testing for it.